Hey, it's Dr. Dunaway here with Chiro Strength, and this is the second video in the knee pain series where we're discussing the assessment and tips to correct areas around the knee instead of just focusing on the knee, because oftentimes knee pain is a symptom of something going on either above or below it. So the previous video we talked about the foot, and now we're going to talk about the hip, specifically the skill of being able to hinge from the hip and not bend from the knees. So if I'm talking about knee sparing exercises, if I'm getting in a chair and I keep my torso upright and my knees come forward, it really loads the knee. If I can bend at the hip and keep the spine nice and stable, that's really going to be beneficial for knee pain and creating an environment to where any type of intervention will last longer and be more effective, instead of going outside that clinic or going outside the office and immediately starting to beat up that knee with poor hip and low back mechanics. So I start the hinge with simple rocking. Can you rock back and forth, keeping the spine nice and stable and not allowing that butt to tuck under? Real simple, back and forth. And then I go into a tall kneeling position. So in a kneeling position like this, I'll have somebody put their toes touching the wall behind them, and I'll say, try and touch your butt back towards your toes and come in this position right here, right? So come in a position where you can lean the torso forward. I don't want you leaning back like this. Allow the torso to come forward. I want the nose to stay on the same point on the floor as if there was a plumb line going down. And try and, again, move from the hips and not from the back. If terminal knee flexion in and of itself, so if getting the knees this far flexed is painful, then we need to regress what we're talking about, and we need to really focus on trying to reestablish range of motion. And that's usually going to be done in a clinical setting, because if range of motion is that painful and that limited, additional interventions need to be taken. So once we understand what hip flexion feels like, keep a neutral spine, and we can do this, I'll start loading a hip hinge. So I have a band right here. And lastly, before we come up to the hands and knees, I'll wrap a belt around and I'll say, okay, allow this to pull you back. And then as you come forward, I want to be able to squeeze the glutes and bring the pelvis underneath us, rather than using the low back muscles to kind of pull us up like this. So again, lock the core in as we push our butt back and our nose stays on that plumb line. Squeeze the butt, come all the way forward, not overextended. And I'll go through a couple reps of this. And then finally, what we'll do is we'll come into a good hinge pattern with butt back, knees stay forward. If someone has trouble with that, I'll put a box, a plyo box, something like that, in front of their shin, and I'll say, push the butt back and don't let your shin hit this, right? And then we come back forward, and then we can progress that to, all right, now this is how far we got to go to sit you into a chair or whatever kind of functional environment that they're going to be in throughout a regular basis. But learning that hip hinge, learning what it feels like to move from the hips, not from the spine, is a huge prerequisite into fully recovering. So if you like that video, go back and watch the foot one. We have another one, another video coming where we'll be discussing the importance of balance and single leg strength. But if you want to read the full blog in that full context, I have a link in the description below. You can read that blog. And let me know if you have any questions. And like I always say, don't just mend, transcend. Thanks.